This is a multi-center study on the prediction of neonatal respiratory morbidity. The technique used to predict this morbidity is the analysis of the fetal lung texture by quantitative ultrasound. "20 centers from 12 different countries have been involved in the study, reaching a total of 730 samples. Qantas FLM is a software able to determine neonatal respiratory morbidity risk just by analyzing an ultrasound image of fetal lungs. The ultrasound images need some requirements in order to ensure the reproducibility of the technique. Here we can see an example of the optimal acquisition of the required image. As it is shown, the required image is a quite standard view, often used in the obstetrics and fetal medicine field. Once obtained, the image must be saved in a pen drive in DICOM format. Qantas FLM software is available online in a web application where images can be uploaded for its analysis. So, once an image is acquired and saved in a pen drive in a DICOM format, next step is to go to Qantas FLM webpage and enter into the application. Then the image must be selected and uploaded. The system will validate that the file is effectively in DICOM format. Next step is to label the image with the basic information about the patient. Name, patient ID, date and gestational age at the time of acquisition are required. Once labeled, it is required to delineate the region of interest of the lung. This region must be an area as big as possible of the proximal lung. Since system analyzes texture of the lung tissue, it is really important not to include the delineation blood vessels or any structure other than lung tissue, shadows from bone structures or artifacts. The system analyzes the sample automatically, and in just a few minutes, the report will be available in the same web application. By clicking on the report, you will get detailed information about the test results. The test will provide a result in terms of high or low risk of neonatal respiratory morbidity, which means that the baseline risk of the fetus to develop neonatal respiratory morbidity is increased or decreased. To determine the performance of this tool, results of Qantas FLM were compared with the clinical outcome to evaluate the sensitivity, specificity, positive and negative predictive values to predict neonatal respiratory morbidity. Qantas FLM was tested in 2 gestational age ranges, below 34 weeks and at or above 34 weeks. Therefore, Qantas FLM predicted neonatal respiratory morbidity with an accuracy similar to that previously reported for other tests, with the advantage of being a non-invasive technique. This may help clinicians and patients in the decision-making process to plan delivery.